On behalf of WHO, for me, it's a great honor and a privilege to be part of this important meeting on autologous hematopoietic stem cell transplantation. Unfortunately, I wasn't able to be with you today because I'm flying to China tonight and I couldn't make it. But I'm sure that next time I will be there with you if you invite me to do so. Well, I've been asked to talk about what's the role of WHO in transplantation. And for those who are not very familiar with WHO, just permit me to spend just 1 minute to show you what our organization is about. If we talk about who we are, WHO came into force in April 1948, and that's why that day, 7th April, we celebrate every year the World Health Day. We are more than 7,000 people working in different countries. It's not 150 now, 194 countries, with headquarters here in Geneva and 6 regional offices. And if we talk what we do, our primary role is to coordinate all international health systems within the United Nations. And we promote health through the life course, non-communicable disease, communicable disease, etc. And where we work? Well, we work with countries. We want to support countries. We want to support mainly government, but also we work with private and governmental foundation and even with the private sectors. If we have a look to all the programs that we have here at WHO, you can see that the list is a huge list of different programs going from all around the different areas of the United States. But if we go to the T, for sure we will find there that it is transplantation there. And why WHO is working on transplantation? And we sit ourselves and think about this, why WHO is thinking about or working on transplantation. We can see that many things have changed in the last 50 years. From the past, and if we talk about organ transplantation, we see that the first kidney transplant performed by Nobel Prize Joseph Norrie in 1954 to the soldiers that were exposed to lethal dose of that radiation during the war, Second World War, and they were dying because of this lethal dose of radiation. And then doctors found out that probably introducing them bone marrow or spleen cells, they would be able to recover that. And that was the first step in the hematopoietic stem cell transplantation. But from that past, now, what is happening now? What is happening now is that we are able to transplant both hands to a lady, and after a few months, she can go back to normal life. And even we can do things like this. We can build artificial tissues using the stem cells to recover people from their diseases. I'm talking about stem cells. It's easy just with local anesthesia. Bone marrow cells from a patient and perfused to himself or herself to recover his health and be a normal pressure again. And also from that 57 first allogenic stem cell transplantation performed by Nobel Prize donor Thomas, many things have changed. What's the future? What's the future in transplantation? If we talk about organs, we can see things like this. We can see things like that someone is trying to make a head transplant. I wouldn't say it's a head transplant, it's more a body transplant. but this Italian surgeon is thinking of that for next year. I don't think it's a good idea from my personal point of view. But what is clear, that if we talk about stem cell transplantation, I'm sure that the future is that it's going to be more complex, but at the same time, it's going to be more individualized, and of course, it's going to be more efficient. And I think that's the future for stem cells. In the meantime, we have resources. We have resources that, like telemedicine, that could help us in making this progress. So what's WHO do? What's the World Health Organization do? Well, we are a technical office. We are just a technical office that analyze medical, ethical, legal, and social issues everywhere. What for? To try to develop normative international health regulation, and of course, we try to implement cooperation network. And if we talk about cooperation network, a good example for that is the worldwide network for blood and marrow transplantation. This is a good example of collaboration within institutions, within foundations, within professionals to make things happen. So there is no reason why two important universities, the Lithuanian University and the Basic University, is no reason for them not to get together. They are not any longer those old universities that was 60 years ago or 70 years ago, but they are new ones with modern facilities able to join together. So, in this context, we, WHO, should develop or try to have to develop a legislative framework. I wouldn't say legislative, because legislative is more related with health authorities, it's more related with government. It's a normative framework. It's an agreement between two institutions to develop a program. And this normative framework should consider some principles of right. It should include autonomy of the patient, of course, no rewards in any of the activities. Of course, they should look at equity in the process, transparency of all the process that they are trying to, and of course, preserving confidentiality of the patients. But also, in this normative framework, what should be included is a quality process. Quality process trying to avoid things like this that happened in the past, like patients contaminated or infected by different virus or bacteria that could put their life in risk. But it's not only a quality process, it's also traceability. Traceability of the whole process with biovigilance of the results. Of course, prohibition of trafficking is not the case of autologous stem cells, but is the case on some other things, trying to avoid things like this that we see all around the world. And this is one of the main tasks for WHO. So this technical office trying to help countries or help institutions in this normative, international health regulation, etc., should be done, or should be done with good governance mechanisms. What those good governance mechanisms mean? Those good governance mechanisms include all these things: transparency. Transparency having registry of all patients. Efficiency with preventive measures to limit the demand of that therapeutic, very high specialized therapeutics. With oversight of all the process, we have to check all the process from the donor to the final result. Trying to promote innovation, and of course, including all the stakeholders in the process. It's not just only patients, it's professional, it's scientific and professional societies, and of course, health authorities. But beside any rule, beside any normative, of course, a legal framework is needed, and this is health authority responsibility. What for? What we need a legal framework? We need a legal framework to the risk of loss of the most basic human values that goes against the Universal Declaration of Human Rights. And that should be done, keeping the national values, national culture, national religion values, national family values. And it's a good opportunity in developing this legal framework to protect not only donors and recipients, but also professionals and the whole community, the whole society by itself. And it's an opportunity that we shouldn't miss to meet these needs, also to rationalize the care and to promote medical teaching, and of course include all the public in this legal framework. Because what is important in transplantation is not only safety, it's not only the results of the transplant, but also the ethics of the transplant, the ethics of the process. That's why, besides that legal framework, an ethical framework is needed. This ethical framework should be based on two main pillars from one another: respect for the dignity of the donors and the recipients, but also with equitable access to transplantation, avoiding any discrimination by all means. And this is very much related with Article number 1 of the WHO Constitution. In that Article number 1 of the WHO Constitution, what they say is, is that the attainment by all people of the highest possible level of health. And when I'm talking about all people, I'm talking about all people. What I'm trying to say with that? I'm trying to say that why, in a country like Lithuania, if a patient that they don't have established system for stem cell transplantation, why a patient suffering from multiple myeloma should not be treated? They have the same rights. They should be treated and they should try to be cured. That's why it is important to have help from others. Help from others, and fortunately, in this time, it's also included in the Council of Europe Declaration, saying that we have the obligation to assist member states, trying to examine their own structures and establish links between organization and expert through Europe and ensure the transfer of knowledge and expertise. This is a mandate of the Council of Europe. We have to help each other in favor of our patients. It's something that we have to build among all of us, something that we have to build within countries. So there should be no barriers for treating a patient. Right now, there should not be a barrier not to have an established system in the own country, because fortunately we have telemedicine. We have the resources, we have the technical resources that could make this happen. And this is according to the WHO guiding principles that health authorities should be aware of that. National health authorities are responsible for defining clear strategies and policies to ensure that safe and effective medical products of human origin are available to meet clinical needs within the framework of their national health system. And that's health authority responsibility. But in this context, it is not only health authorities, it's also regional, scientific, and professional society that should collaborate in that. Doing what? Developing global codes of practice of ethical leadership along guiding principles. They should also promote global good practice in relation to quality and safety, advocating for harmonized practice, such as accreditation and use of standards, and that should be done in collaboration with all stakeholders. monitoring regional and global access, and monitoring data, what's the results from that project, and contributing to vigilance and surveillance. And all this should be done in a framework of transparency. So, if you ask me again, what's the role of the WHO in transplantation? The WHO is also part of that. It's not also health authorities, it's not also just professional, but we have to do many things in common, like collaborate in the development of legislation. Of course, the same, monitoring that global codes of practice along guiding principles, promoting this good practice in relation to quality as well, but ensuring equitable access of the population to the transplant, help in developing those models of donation, most appropriate for each country, with professional training, trying to do this continuous professional training, contributing to vigilance and surveillance, and of course, and again, as professional, ensuring transparency of the process. So this is something that we should do all together. And I think if we have the resources, if we have the technology now, and at the same time, we have professional like Dr. Mike Deviser, well, doing very good. Just to finish, let me finish with an Indian proverb that says, if you want to go fast, go alone. But if you want to go far, go with others. And this is the thing that Leipzig University, together with the Lieutenant University, are doing. They're going together to go far. So that's all. Thanks very much.